Dylan Livingston. How are you, my man?
I'm good. I'm good. Thanks, Jason, for having me. Do we want to restart that?
Yeah, you're good.
All right.
You're
All
good.
right. All right.
It will add flavor to it. Hey, dude, look, this is just a conversation. One thing about the Healthy CEO as well as the Jason Wright Show is we're very relaxed here. I mean, I know you're a big, serious CEO and founder of a very important foundation, but just relax,
Yeah,
just
it's all
chill.
good. This is what I did. Please, I was just in the California State House on Monday, getting a resolution passed. I can handle it.
Oh, I'm not. That's my point. We know you're very important, Dylan. Everybody listening knows you're very
Very
important.
important.
My podcast is not. So you can just relax. It's not the state house. I'm not a U.S. senator. This is just you just relax. In all seriousness, and folks, in case you can't tell, Dylan and I are friends, and we can bust each other's chops. I do think the work that you're doing is incredibly important. That's why I want to have you on the show. It's one of the reasons why I love hanging out with you because we share a passion for something that we take beyond just a buzzword, kind of a health and wellness cool thing, which is longevity. That's kind of like one of the topics of the day that everybody wants to somehow find a way to get behind. Either a marketer wants to say that their supplement is good for longevity. Physicians are saying we're a longevity doctor, but you and I try to go a little deeper. And one of the things that really impresses me about you is that you are pushing for policy that can lead to more longevity for the American people. So I think before to kind of kick this off, let's talk about how you did this because it's a pretty remarkable feat. You're a young guy, you're a very bright guy. And again, when it came to longevity, you didn't go start a supplement company, you didn't start a podcast, you didn't write a book. You went out and did something completely different with the foundation. So kind of give the audience an understanding of the history of the Alliance for Longevity Initiatives and how you conceived of it and just kind of the origin story, man.
Yeah, yeah, totally. And I probably told you this over lunch at some point, so you've probably heard this before. But for the audience, I first got introduced to the idea of longevity when I was maybe 12 or 13 years old. My father runs a broker dealer and has been very involved with emerging technologies over my whole life, starting with nanotech back in the early 2000s. I remember going to his conferences. And then one day he was driving me to school in like middle school and he showed me a video of Aubrey de Grey. Now, I know you know Aubrey, Jason. For those of you that don't, I would go Google him and look at his first picture and put yourself in my shoes as someone who had just finished reading. Like I read Lord of the Rings and was I think in the middle of the Harry Potter book at that time. Like I think the fourth one. It was Gandalf, right? It was Gandalf. It was a man who looked exactly like Gandalf with a British accent, standing up on stage talking about potions to defeat aging, right? And it was really sort of like the mysticism around Aubrey that really captured my attention and planted this as a kind of core memory in my mind. I forgot about it, a little bit growing up, going through high school and college. You're not really thinking about that aging and generally quite as much in that age frame. But COVID came around and kind of set me back on this path. I remember, I was pitching in my final season of college baseball, and we were down in Florida, and COVID struck, and the next thing you know, a week later, I'm, in a house with my 92-year-old grandfather at the time, and just kind of watching him deal with how COVID was unfolding was sort of traumatic for me. Watching him watch his friends get COVID and, who were in nursing homes and, kind of face isolation, even though he was with us and sort of, all the things that go with an elderly man and a pandemic. Kind of watching that put me back on this path to be interested in aging from the mindset of like, wow, I don't want to be 90 years old and have to worry about going outside because of the pandemic. Me as a 22-year-old at the time, a college athlete, I was pretty well equipped to handle COVID, but my grandfather, who was not, was, had a far greater risk to to get the disease and die. And so that kind of set me back on this path. And I remember talking to my dad, and I remember talking to him about aging in general and getting older. It was also this sort of coming of age moment with me graduating college, where I found myself in a basement rather than a graduation stage. And so it was all these kind of things coming together. And I started watching Aubrey videos and reading his book, and then I moved to David Sinclair, and then I found the Brian Kennedys and the Near Barzilais, and then Brian Johnson popped up. And so I started back in this field more as a fanboy, just someone who was like interested in the idea of creating interventions that will ultimately help us live healthier and longer. At the same time, I was working in politics, and after my political foray in 2020, I realized I was in a unique position because I had this political experience. I had this, interest and knowledge about longevity, and no one else on earth was talking about it, right? It was a completely empty lane that I was, passionate about. I debated going to get a master's, maybe, going down that route. I have too much ADD to sit at a bench for too long, so I don't think that would have worked out if I tried. But I also realized that, policy, I can spend my time doing this, or I can move policy and move institutions to put more money into this field so 100,000 people can do this full time, right? And I found that a lot more compelling. Moving things at a civilizational scale, a societal scale, has a much greater impact than any contribution I would have made on the bench. And so I decided to pursue this. That plus the political angle, made this viable. And I got started with this idea in February 2021. Kind of shopped around. I didn't know anybody in the field. I was a fresh-faced, pretty much baby at that point. And just wanted to figure out what the field was really talking about. Who were the players in the field? What were the companies? What were the investors? Who were what was the path for a longevity biotech company? What was the path for a consumer wellness longevity clinic, right? Like, what are the obstacles that they face that are induced by the government? And, that kind of set the framework for what we advocate for today. And so we officially got launched with, some backing, some financial backing, some board of directors, a team in January 2022. And I guess it's 2026 now. So 4.5 years in, we're still kicking. And I think, the momentum has shifted from, with the advent of COVID really started it, but with GLPs and peptides, I think this whole conversation around longevity, specifically around the biotech angle, is a lot more palatable today than it was when I first started. And so I'm really excited. I did mention in the beginning that we were in California on Monday getting a resolution passed to make longevity a priority, longevity and healthy aging a priority of the California state government. And that's something that I, didn't really imagine when I first started. So the progress is tangible, and it's exciting to be a part of it. Really, it's my life's mission.
This episode of The Healthy CEO is brought to you by Authentic Health, your trusted source for foundational supplements designed to help you live longer, stronger, and with more energy. At Authentic Health, we believe that better health starts at the cellular level. That's why our carefully crafted supplement stack is built to support cellular health, protect against environmental toxins, and give your body the foundation it needs to thrive every single day. And here's something special just for listeners of The Healthy CEO. Head over to shopauthentichealth.com and use the promo code JASON at checkout to receive an exclusive discount on your order. Take charge of your health, invest in your longevity, and fuel your performance with Authentic Health.
Well, I love the fact that you're getting these lawmakers and the policymakers to actually have the conversation. So let's just talk about, since you just came from California, it's fresh on your mind. So I know one of the things that whenever I have advocated for the Access to Health Foundation, a lot of the things that I talk about, which overlap with much of the work you're doing there, it's access to care, it's value-based care, it's trying to focus on outcomes and not just getting people covered with insurance and seeing doctors, but actually keeping them healthier. And whenever you go to a lawmaker, they all think it sounds great, but a lot of them are just so ignorant to what's out there. And I don't say stupid. They're just ignorant. They don't know what they don't know. What are some of the things that you're finding people in the policymaking space, like out in California, that they're willing to listen to? And how are you attacking this? Is it getting them to get more longevity drugs, like our friend Matt Camerline, some of the stuff he's doing with rapamycin, getting some, are they going to start covering on, state exchanges, rapamycin or metformin or some of these things that are tied to longevity? Like, what are they willing to do? And what do you want them to do, Dylan? Like, if you go to a state rep, a state senator, what do you want them to do? You got them to make the resolution to, okay, now it's a focus. It's on our list. Let's talk about some things. Then where do you take it from there to get them to actually put some action behind the intent?
Sure. Yeah. So, I mean, the whole idea here from a political standpoint is we are trying to achieve the longevity dividend for the country, for society, right? And that's the idea of what happens to the economy, to economic growth, when an extra healthy year of life expectancy is added to a population. And there's been a few studies, but pretty much the range of outcomes show that this is in the trillions for one extra year. Several trillions, like the highest estimate is up to 38 trillion for one extra year of healthy lifespan. And that comes from, a decrease in costs to Medicare and pensions and private insurers and all of the people paying for our declining health as we age. But then the other aspect there is the increase in economic productivity, right? People are able to work longer if they choose to. They are able to go out and participate in society, go see a movie, go to a restaurant, things like that, right? And all of that is especially in a consumer-led economy, that is, how growth is kind of created. And so that's kind of the North Star, right? And there's different flavors of longevity. Longevity exists today, right? But it's really for people who can afford it, both with their time and their money, right? Like we see Brian Johnson. I think Brian, is doing a really great job in getting the word out there. But I think the way that he lives is, to a lot of people, just unattainable. They don't have the resources or the time to, take 50 vitamins a day and work out for 2 hours and do a sauna and a cold plunge and a this, that, and the other thing, right? Real life gets in the way. If you're a single mother with 2 kids, are you able to go to bed at 9 p.m. every night and wake up at 6 a.m.? Like, it's just not feasible for 99% of people, which is why I'm so intent on pushing therapeutics. It is the great equalizer in many ways, right? Especially things that are democratized. And like you mentioned, rapamycin and metformin, these are things that cost pennies to make. You can buy them over the black market. You can get a prescription for them from your doctor, right? And they are so cheap and accessible. And, again, I think, both rapamycin and metformin are not fully validated with like a human study, but they are doing human studies right now. Matt's doing the dog aging project. If these are validated, we should be getting these into the hands of every single person, right? And that's the great equalizer. That's what allows the single mother with 2 kids to have a healthy lifespan of 80 years, the same as, probably what Brian Johnson's going to have right now, right? And that also helps Brian Johnson because he is still able to do a stack of all this healthy living plus a therapeutic that has probably an additive effect, and he gets to live, extra healthy years as well. At the end of the day, for me, this is a moral crusade. And I did mention the economics, that is part of it. But at the end of the day, I want my family, for me personally, for you, Jason, for everybody in your life, for everybody, I want everybody to live healthier and longer and spend more time doing the things they love with the people they love, right? There's nothing worse than seeing someone you love deteriorate physically. It's heartbreaking, right? It's like really the word, my worst memories in life are being in the hospital, right? And watching my grandmother pass away. It's a terrible thing. And so if we can, effectively create drugs that give everybody an outcome that is better than what they're getting today, I think it's the most moral and humanitarian mission on earth. So that's why I do it. And to go back to your initial question, I think when you're talking to politicians, it depends on who you're talking to, which one of these 2 arguments you can use. At the end of the day, politicians do care about like getting reelected. And so if you can always pull it back to like jobs and, economic security and growth and, competition with the geopolitical adversaries, right? Like, you can get them on that angle, but, we're still waiting for the first politician to come out with that moral argument, right? And that's what I would like to see. I'm just kind of spitballing at you, but that's what I would like to see. That would be a real sea change in the way that the politicians that I work with talk about this issue, and I think that would move things forward. It's having like a crusader for longevity and for this mission of giving everybody as many healthy life years as they can have on Earth, right?
Yeah, I mean, it goes back, and that's one of the things where I think you and I are so equally aligned on this. Like, so at Authentic Health Partners, my company that I co-founded, that came out of Gus Vickery going to Uganda to an orphanage and seeing that the kids had nutritionally dense food, they just didn't have enough calories. So he's like, in America, it's the opposite. We got all the calories, but the nutritional density is not there. So he's like, I want to take this formulation that I'm giving my patients, and I want to make it so that it's more democratized, that they can get to the folks that actually need it, not just because they want to get, because to your point, not because they have the luxury of thinking about longevity and health span and all these things that you and I geek out on, but just for their mere survival.
Right.
And that's one of the things that we're trying to do. And I would think that the politicians would start to, and the ones that I'm talking to through our foundation, they seem to be much more open when you say, hey, look, all these things like what Brian's doing, Joel Green, Ben Greenfield, that are really cool, that are kind of reserved for the tech bros and the finance bros. If you can get everyday people, just not, maybe to your point, they may not go do the sauna or the cold plunge, but they can at least take some of the pieces of the discoveries that are found. It's like, I'm not one of these guys that knocks Brian. I do think the dude needs a little more sun, but he's, but whatever, he knows what he's doing. And I'm just kind of saying that tongue in cheek. But when I've talked to people about Brian Johnson and the blueprint, I'm like, look, because did you see that Jubilee debate that he did with all the people that were basically ragging on him, making this argument, you're rich and you could do all these things. And he was like, he tried to explain to them that he's using himself to discover new things. I think Brian Johnson's like kind of the idea of the space program. When you have these people that say NASA should be shuttered because there's nothing good that comes of it. It's just $1 billion to go into space. Well, but there are so many things technologically related that we have benefited from as a result of pursuing the space program. Totally. It's the same thing. If Brian can spend his personal treasure on himself and discover some things that, this can be made universal for everybody to get healthier and increase their health span, their lifespan, then maybe it is worthwhile. Now, one of the things too that I bet this audience probably hasn't put a lot of thought into, that I know you're digging into and I'm trying to help you with also, is this idea of right to try. A lot of people, they don't do the stuff that you and I do. So they're not out there looking at what the FDA is and the long kind of trying to sprint through quicksand that a lot of these biotech companies go through to try to bring products to market that not only have proven that they could help a patient, whether it's with cancer or whatever the case may be, whatever the malady might be. But not only that, you've got a willing participant in the patient that's saying, hey, look, I've been given a year to live. What's the loss here? And then you've got the federal government that'll come in and say, biotech company, no, you cannot give it to that willing and able participant. We're saying the two of you can't come together. But what you're trying to do is to fight to make that possible, where people are willing to raise their hand and say, I'll be the guinea pig. What have I got to lose? And the biotech company, they've done the research. They say, we think we can really extend your life, and put those two together. Talk to this audience a little bit about what Right to Try is, some of the obstacles you face, and even some of the work, maybe if you want to mention the work that Nicholas is doing, just kind of what is that? And also, I think it's a great way to highlight what you're doing at your foundation with what you did in Montana. I think that was incredibly powerful. So just kind of bring the audience up to speed on Right to Try.
Yeah. So the first thing I'll say is, you said that you used the word proven, and so none of the things we're talking about here are proven. So, if you're listening to this, this is not an endorsement for drugs that haven't gone through the FDA trial. That's still very important, right? But with that being said, Right to Try is the idea that if you are a terminal patient, you have 6 months to live, you can access a therapeutic that is not fully approved through efficacy trials, right? And to you and me, that's a no-brainer. That's like, again, what do you have to lose if you're gonna, if you see the end anyways and you're in terrible pain? We have right to die laws, right? So like we might as well have right to try laws too. That's a no-brainer, and that was signed into law by President Trump in 2017, I believe. The issue there's a few issues with this right to try law, but basically what it says is, yeah, like I said, if you're a terminal patient, you can try. The issue though is, one, there's no real liability coverage for the providers of these therapeutics, the manufacturer, the companies, and the actual clinicians. And so, a lot of the biotechs that like should be willing to participate weren't, because they had no legal coverage. The second real big issue is the terminal designation means to me, and I think a lot of aging biologists out there, and probably most doctors, that it's probably too late to intervene in many cases. Still worth trying for sure, but put yourself in an Alzheimer's patient's shoes, right? Would you like to try an experimental therapy in the beginning of your diagnosis, at the end? I mean, and again, this is why it's the right to try. You should have the right to try at any point in your diagnosis, especially if you know that, whether it's 6 months, 5 years, or 10 years, it's still a terminal diagnosis, right? And so what we did was we removed the designation for terminal illness in Montana and now New Hampshire as well. We got a bill passed last week that kind of expands on what Montana did. Not fully the same. We're working on another bill that will hopefully kind of get it up to par with Montana's regime. But what we did in both those cases was remove the terminal designation for being necessary for this right to try. So now, in theory, anybody can go and try a therapeutic as long as it's passed phase 1 safety trials. These drugs need to be safe. We don't want to be like giving drugs that aren't proven to not instantly kill you, and then a bunch of people start dying in Montana. There needs to be some sort of evidence. But if people are willing to take the risk that something is not efficacious or not, and they're willing to spend their own money, I don't see the issue with it, right? Or in a lot of cases also, these companies want the data, so they are willing to kind of do it at cost or for free. But if people are willing participants, they should have this right to try. From the biotech angle, there's a lot of companies that enter what's called the valley of death. And so a lot of companies will raise a seed round and maybe a Series A, but like once you hit that Series B and C mark, close to IPO, that's where a lot of them stall out, can't raise enough money, run out of money. If something goes wrong in a trial, X, Y, Z, right? In many cases, though, it is people just kind of have a hard time raising the money that they need to show data to show that their drug works. And so what this offers biotechs for willing participants and patients is an opportunity to generate data to kind of steer capital in a more sophisticated direction. There's a ton of instances out there where, this is why 95% or something like that of the drugs that enter an IND end up not getting passed. A lot of companies, though, just kind of run out of money or aren't able to raise or aren't able to pivot appropriately if something goes wrong. But really, again, the big one is the raise piece. So if we can kind of de-risk some investments and steer capital towards things that in a real world setting seem to work, it's beneficial to the patients, it's beneficial to the investors, and it's beneficial to the biotechs, right? I'll give an example. Say biotech A is doing something for inflammation, and they do a few, they give it out to a few patients under Montana's right to try regime, and it turns out it's not effective, and there's no evidence that it's effective. They didn't waste $1 billion, not $1 billion, but a ton of money on a clinical trial, and now they can reformulate and kind of go back to the drawing board, right? Or company B is doing something with neuroinflammation or dementia, and they're just having the toughest time. They're maybe in Kansas. Their company's headquartered in Kansas, and they're not connected to the venture capital ecosystems. What they can do is go to Montana and test it out. And let's say it works, then they have evidence to go to Silicon Valley and Boston and these big financing hubs to get their drug to an actual clinical trial. So it provides options for these biotechs. I expect this to be like a biotech accelerator kind of regime. And then also for these patients who really have no other option. And, not only no other option, but bad options, right? It's a bad option to wait until the very end to try to treat a terminal illness. You should have the right, if you decide at the beginning of your Alzheimer's diagnosis or at the beginning of your cancer diagnosis, that you want to try something that is kind of next generation and maybe doesn't have a full efficacy trial, but we know is at least somewhat safe, right? Safe in the immediate sense. And there's risks there. And I don't expect this to be something that everybody on earth does, but basically what we're trying to provide here for patients is the option to get the care that they think they need. We're in an age where you can ask, AI, you can ask Mythos from Claude to be your personal doctor, and it's going to be as smart as pretty much every doctor out there, right? We have this access to the knowledge and the sophisticated knowledge that we never had in any other time. People are getting smarter with, how to use these tools. I don't know if you saw, there was that guy who created, it was either his or his dog's cancer vaccine just by Claude. And I think it's crazy what you're able to do now, right, is the point. And so, with more information, people should have more, there should be less gatekeeping by people in suits in Washington, basically.
Yeah. Yeah, I need to get you with, obviously through our holding company, we work with a lot of the major insurance carriers, one of which that we're partnering with, or we're trying to establish a partnership with for the Agility Cares Health Access Centers is Oscar Health, which is one of the leaders in technology and insurance coverage. And they have tied to their programs or to their plans, Oscar Well, and it's basically an AI health coach, and it's pretty remarkable. And the cool thing about it is it actually ties the health, instead of it just being kind of like a bolt-on chat GPT that you skin it with an app and then really it's just chat GPT running in the background. It knows your health plan. And so you can have Oswell that's fully knowledgeable of your health plan work in conjunction with you and your health goals. So let's say that you do start taking GLP-1s and you don't want to be like a lot of these people that are taking them and becoming emaciated. Instead, Oswell will help you, at least the way I understand it. The health coach component can tell you, hey, okay, good, you're on GLP-1s, you're going to reduce your weight by quite a bit, but you want to maintain lean body mass. So here's some protein targets you might need to hit. Here's some resistance training you might need to go through so that you don't lose those things, which I think is pretty cool. And that's the thing that I'm excited now about with regard, because of foundations like yours and the people you're surrounding yourself with. We're going to get those extra years. I fully believe, and they're not just extra years. They're extra productive years. I mean, I know for me, Dylan, I haven't achieved a fraction of the things I want to, selfishly, just ambitious goals I have. But you know what? And it's one of the reasons why I pursue longevity the way I do is not just because I don't want to be here forever. I want to hit the century mark. I think I want to be healthy till 100. Then hopefully on my 100th birthday, have a great day. I feel great, and boom, just drop dead, and it's over. I don't want to ever be sick. But the main reason for me is I want to see I'd love to see great grandchildren. I would love to keep doing stuff like this podcast and some of the things that you and I may work on together in the future. And I mean, I turned 51 this year, and I feel like I've had a full life. I raised Rylan and Abby. Rylan just got married. Abby will probably be married within the next year or so. It's like that whole phase of life has come. Now it's like Jason Life 2.0. Well, I want a lot of years stacked in there, a lot of productive years. And so to be able to give that to the general population, I think is just remarkable. So, all right, so now let's move to because you get an upfront look at a lot of cool things happening, as well as you get to interact with some of the biggest brains in the industry, in biotech, in not just that, the tech world, that people that have nothing to do with healthcare, but are interested in longevity and some of the things we're talking about. What are some of the coolest things, either therapeutic wise or otherwise, that you're seeing now that give you hope that you can use an example to take to a lawmaker and say, hey, did you know that this guy at Stanford University just created this therapeutic, that this is what it's showing in mice, that when it goes to humans, that this could be the outcomes? What are some of the coolest things that you're seeing right now?
I like to try to, so I didn't really get into what the organization is, our A4LI, but we're a coalition of basically the entire longevity biotech industry. We have about 75 partner companies, of a few venture firms, nonprofits, but it's a pretty big chunk of this industry. And so I try to be careful with what I say, just not to make anybody upset for saying the wrong thing. I am not a biologist by training either. So, take everything I say with a little bit of, just a little bit of caution. But what I will say is, one, what we talked about is AI, and it's kind of a cop-out answer. I hate when other people say it, but it's sort of a mealy-mouthed middle ground way of avoiding which companies are to talk about too much. But it's also true in that I see, every company I work with is implementing AI at scale, right? They're anything that can be done by AI is being done by AI, from the drug discovery process to the drug manufacturing process, through robotics and automation, to the everyday kind of BS that they probably don't want to deal with. And that is such an accelerant in the way that these companies work, that it makes me believe, one, that the existing companies today have a much better chance than they did 5 years ago of getting a drug approved. But it also encourages me to think that there are probably researchers out there. There's probably I'm in the Bay Area right now. There's probably a researcher at Stanford right now that's trying to create a biotech with just one person and fully autonomous and AI, right? And if we have enough smart agentic AI doing all of the work that we are kind of we're feeding it, that accelerates things to, and this is, again, the whole point of like the singularity, if you ever know about Ray Kurzweil and all that stuff. But it's true, right? Like, we are on that exponential growth curve with compute, and I think it's going to bleed heavily. It's already bleeding heavily into the biotech space. But once we have autonomous robots doing the work that lab technicians were doing, so it means that one lab technician needs to be there instead of the whole team. Things get a lot quicker, right? Things move a lot quicker. So that's one aspect of it. I really, I would say from a therapeutic standpoint, the whole reprogramming space is really cool. I don't think that's too controversial. I think everybody agrees that if reprogram, and the process of reprogramming is basically reverting a stem cell not too far to the point where it loses its identity, right? So they can introduce these proteins called Yamanaka factors that essentially revert a skin cell or a liver cell to a stem cell. And the goal is to fine tune it so that you create a younger version of that cell without making your liver cells a stem cell, so it loses its function and identity, right? And if that happens, like that's pretty freaking groundbreaking right there. That kind of ensures that you don't need to age ever, because you can then find a way to reset every single cell in your body to be the age of how you were at 20 or 30, right? So I think that's really it. There are going to be definitely some tricks. Obviously, this is still very new. The paper that came out that discovered the Yamanaka factors, I think, was in the early mid 2010s. And the companies that have, a lot of behemoths are going after it, though, like New Limit with Brian Armstrong, and Retro with Sam Altman, and Altos Labs with Jeff Bezos, and David Sinclair's company just announced today that they just dosed their first patient with a reprogramming drug today. So we'll see how that turns out. That's really exciting, in that, these were all theoretical, and now there's something in somebody somewhere with this. Yeah. Right. That's freaking, that's freaking cool. So I'm really bullish. I mean, that seems to be the silver bullet at the moment, if we were going to pick one to cure all longevity. And I would assume first generation, maybe even second or third generation, won't get there, but this is probably the pathway to that silver bullet, stay young forever with a pill kind of thing that we probably saw in some future show back in the day. Beyond that, though, I mean, I think the fundamental understandings around aging biology are advancing, again, with AI, but also with increased interest in the field, faster than they ever have. This is part of the fight that I have all the time. We should be funding this research far more, right? And I kind of talked about the sci-fi aspects here, but the real reason is all of the diseases that ultimately cost us so much money and kill us are driven by aging. We die, we all die. We are 87% of us will die of one of four diseases: cancer, diabetes, Alzheimer's, and stroke, I believe it is. And those are all directly driven by the aging process and the cellular dysfunction that is caused by age. And so what we say is, to the government all the time is we should be investing in this root cause therapeutic pathway so that, instead of creating drugs to cure all of these diseases at once, we can create a drug that just prevents them. And we can continuously be preventative with these drugs. And so to kind of bring it back, there is more funding, there's more venture capital, there's more, philanthropy, and there is still a decent amount of money at the federal government through ARPA-H and the NIH and NSF going towards this field where, we're really seeing gains in the understanding of, the hallmarks of aging, how they interact, what's upstream, what's downstream, how we can target them with therapeutics and interventions. And so just like Matt, we keep bringing up Matt Kaberlein, but he gave a great quote 2 years ago at our congressional briefing. And he said, well, he was giving his talk and he pulled up a picture of the map of like the Mediterranean in 200 BC. And he was like, this is where we are right now in aging biology. We have enough to get around from, Spain to, the Middle East and, up to France and down to Africa. And we know, what we have is useful, right, to make things and do things. But really, there's a whole other world out there, right, that we don't know of and that we're discovering right now. So I would put this, we're kind of at like the Columbus age of longevity. The time scale is not going to be, it's going to be a lot quicker than that. It's for everybody out there, just so you know. But we're just realizing what we don't realize, and now we're in the exploratory phase, which is really exciting because, reprogramming is great. Do I think it's going to be the, is that the end all be all? Maybe not, right? There's probably things that we don't know that are more effective to longer, healthier lives.
Well, the thing that I like about it and the work that you're doing is it's what I try to tell everyone that will listen is that life shouldn't be, and your personal health shouldn't be just waiting for one of those four causes to show up. It doesn't have to be. That's one of the things that whenever I read David Sinclair's book the first time, and he posed that question about, is aging a disease? And whether you believe it or not, conceptually, it has some utility value in just addressing your aging as a disease. And that's what I do. I mean, I look at my physical training regimen as kind of like physical medication for this thing called aging. I look at my guitar behind me, which I play horribly, and and by the way, I'm trying to learn Italian. I told you that. So
Yeah, I can't help you with that. I took like years of Italian in school. Still not.
Yeah, exactly. But those are things those are like, I look at those as therapeutics for aging, my brain. And, and it's all these things that if we can get people in this mindset that your health doesn't have to, you don't have to wait till you get that horrible diagnosis, right. Whether it's hypertension, whether it's, cancer cells, whatever, you can do these things. And I think that it's going to take organizations like yours to, again, make the lawmakers realize this has to be a part of the national health conversation. Totally. It can't just be, well, we've got to make sure that we subsidize the ACA to get everybody health insurance, and we've got to make sure that, Medicare Part D is robust and they're able to get all the drugs they need. And I'm not anti-pharmaceutical. I'm just saying that you need to put somewhere in this mix. And I do think we're finally reaching that point that you add a wellness component to this. And it can't be, I talk about this with our insurance carriers all the time. We have these conversations like, yeah, and that's why I bring up the Oswell that Oscar's doing. It's like, I have Blue Cross Blue Shield. I'll get some random phone call about somebody saying, hey, did you know that you have a health coach as part of your program or whatever? I'm like, well, okay, I'm the last person that needs that, and I'm glad that you do it. But I'm thinking about just the normal everyday member of Blue Cross Blue Shield getting that phone call, probably not going to be all that effective. But if we can get more push towards, okay, your insurance now does cover these GLP-1s and it covers some education. And by the way, there are all these just promotional, these educational vehicles to get people to understand you have way more agency on your wellness than what you realize. And I think we can start making some good strides. And I think that's what you guys are doing. So I commend the work that you're doing,
I
Dylan.
appreciate it. Yeah, no, it is really about changing the conversation, right? And people talk about it all the time. We have a sick care system, not a healthcare system, and it's true. And again, I am all about being preventative in lifestyle, exercise, diet, socializing, learning, all that kind of stuff, right? But I do think it's not possible for a lot of people. Not possible from like a time commitment standpoint. Like, again, like I'm thinking of this single mother who is running around with two kids until they're 18. And by the time they're 50, it's kind of hard to kind of go back, right? I'm also thinking about people that just, people like don't have willpower, right? To like do things. And unless you're going to change people's willpower to do things, they're not going to change. Like we've known for 100 years, since the beginning of time, that you need to exercise and you need to eat well and you need to learn and you need to have, a good social life. And there's a pretty sizable portion of the population that doesn't do it. Right.
Yeah.
And so, I mean, look, we can say, hey, you're not doing the things you need to do, so you're condemned and you're going to be sick. One, I don't want to do that. But two, we're still paying for it at the end of the day, right? Like with our tax dollars, when they're on Medicare and they get a disease at 65 instead of 70, we're paying for the 5 years of diseases that were. So it's in our interest, even if we're like, oh, you're lazy, oh, blah, 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 blah. It's still in our best interest financially and morally to create these drugs that give these people a chance who are either unwilling or unable to live a long, healthy life as well, right? And so I'm totally with you. It's about it. It's really about changing the way people think around the way that we do healthcare, around the way that around the way that we do healthcare and the way that we think about lifelong health, right? And I think another interesting thing too is, there was a study that came out maybe a year ago that shows that aging actually starts in the womb, right? And you're aging in the womb from your birth. And I mean, it's intuitive, right? You're aging up, but you don't think about it as like there's this semi-degenerative effect, even though it's not, to the point where it's critical, where you get disease. You're still aging, right? The process of aging is essentially cell damage accumulated over time that leads to dysfunction. And you're aging from the moment you're born, from before. So I think the other part of the conversation that needs to be changed is like lifelong care, starting these preventative either therapeutics or interventions or lifestyle mechanisms as early as possible too. And this, again, goes back to the whole right to try thing I was talking about. We shouldn't wait until someone's terminally ill to let them try a drug. They should have the option at the very least to try a drug when they get sick, whether it's, right away or 2 years into the disease or 5 years into the disease, but they should have that option. And the earlier we start preventative or curative medicines, the better the outcome is. So it's just about changing how people, and it's hard. It's a really hard conversation. There's a lot of inertia around what the status quo has been because it's worked. If you look at lifespan gains since we started this whole kind of sick care regime, it's doubled, right? Like we started this and maybe not doubled, but it's gone up from probably about like 55 in the 40s to 80 now, 78, 80, right? Depends on what you look at, 90 maybe, right? So it's worked enough, but now we're at the point where people are living to 80, 60, 70, 80, 90 pretty regularly. And with the diseases that also cost money, like it cost money before to treat people for, flu outbreaks. So we made penicillin and then people live till 80. So now the new battle is age-related diseases, right? And we just have to think about it differently. This is the next generation of medicine. And, I think it is up to organizations like ours and these kind of forward-thinking people to lead the way. I take great pride in the idea that I can be an influential person for the course of human health.
Very good. Well, all right. So we got your conference coming up. I'm excited to attend. I can't wait. So what are we going to do? Who else is going to be there? Where are people going to learn at that?
Yeah, it'll be our third annual DC Summit. We're partnering with Georgetown University this year, so that's a nice partnership that hopefully will be ongoing. Um, yeah, so day one will be sort of our focus on industry. So we'll have a lot of the big companies speak, Altos Labs, RetroBio, Life Biosciences, which I just mentioned, BioAge, pretty much all the big players, a lot of the physicians in the space, a lot of the researchers from various universities from around the country. Um, We'll also have Roshan Johnson, who's a running back for the Chicago Bears, coming to talk about, how longevity and resilience kind of intersect with his career path, which I think will be cool. And then we'll be capped off at the end of the day by Lee Hood, who was basically the architect of the Human Genome Project. So that'll be great. He'll kind of cap off the day. The second day will be our policy day. So we'll do some talks in the morning about specific initiatives that A4LI supports, more funding for the NIH, where that money would go, how we could be responsible with tracking all that kind of stuff, FDA strategies, Medicare strategies. And then the second half of the second day will be a lot of elected officials and political speakers. So we're still waiting on the ethics clearance from Dr. Oz's team, but it's looking like he'll be there. Alicia Jackson from ARPA-H are members of our caucus, some members of Congress from the Bay Area, from Boston, to talk with some companies from out there. So it should be a really interesting event. I'm really excited. This is definitely the best production we've put on. We have a great space at Georgetown. The third day we'll be doing a briefing on the Hill, where the very famous Twitter personality Cremieux will be giving a talk. And he's a great follow. I highly recommend you give him a follow. He's a buddy, but he will be kind of talking in, not kind of talking, he will be focusing mainly on the biotech race between China and the US right now. And unfortunately for us, China is starting to eat our lunch. And so there's some things that we can do at the federal level to make sure that's not the case, but that's a scary proposition for us. So Cremieux is going to come talk about that, and then we'll do a panel with some ARPA-H and actually Matt Caberline. So it'll be a great event. Then we'll send on that last day, we'll send all of our companies out to do a Hill Day, so they'll go out and do six, seven meetings. Do you know 6-7, Jason?
Yes, it's so silly, dude. I don't mean, yes, I know 6-7.
All right,
Of course,
all
it doesn't mean anything. I know that it doesn't mean anything. It's just but all the cool kids, 6-7.
Well, it's just anytime I say it's just natural now, just natural.
Or it's, yeah. Well, you're doing good, so I
but-
expect nothing you than to rock the
Listen,
6-7.
I'm Gen Z, man. I'm still Gen Z.
Yes, yes, you are.
No, but then they'll go out and do their Hill meeting. So it'll be a pretty action-packed 3 days. We're still have some room for some people if they want to buy a ticket. It's capped at about 300, and so we're getting close to that now. So it's gonna be great. I'm glad you're coming, and hopefully, the goal of these conferences is to bring these legislators, bring these elected officials to meet with the longevity field, right? To understand that this field does exist. And it exists enough where hundreds of people from around the country are willing to stop by and participate, right? And our first event was about 60, 70 people in DC. The one we did last year was about 125. So we're going to come close, if not surpass doubling it this year, which is really exciting. It kind of, like I said in the beginning, shows the continued growth and the momentum this field has. I'll have to think if we can fit double next year. I think Georgetown has a limit. I do like working with them, so this might be the last doubling we do for a little bit. But it's a really great conference, and we're the only organization with this kind of focus of, or the only conference in the longevity space with this kind of focus of, come for the conference, stay for the political action. Right? There's an actual, there's a lot of conferences out there where I get invited to speak, and I'm just like, what am I doing here? But there's no mistaking what you're doing there for LI. You're there to, come to the briefing and meet with the staffers in the crowd, and go to the Hill and do your member meetings and, engage with the government in a new way.
Well, I tell you what, it's really cool, and that's a perfect place to kind of wrap this up, is to show, like we talked about the beginnings, and then for you to get to the point where now you got a 300-person event, 3 days, and it's making a real significance, making an impact on the Hill. I know I owe you a list of names of some folks that I'm trying to get to there from the elected official side. And so I'll be working on that still. But either way, anything I can do to support you, man, I'm here for it and I appreciate it. And dude, I'm so glad we finally got you on the show. We need to do this more often.
I'm down. I enjoy it. I had a podcast and then I stopped doing the podcast just
I
because
know I wanted to keep it going with you. That's what we were do.
Let's figure something out. I like it. I like being able to vent, and like just talk. My grandfather doesn't stop talking at the dinner table. We're all done with her. I think I have his gene a little bit where I can just kind of talk and talk and talk. So I enjoy it, but it's hard to do a podcast. It's like a lot of work, even just booking people. It's hard. Yeah. So I give you kudos and thanks for having me on. We should do this. We'll do this more.
I would love that, man. Anything I can do to support you, I'm here for it. You're a good dude. You're a smart guy, and I admire the work you're doing. So I'm here to support you any way I can, my brother.
Likewise. Thanks for having me on, Jason.
Thanks, Dylan.
The content provided in this podcast, The Healthy CEO, is for informational and educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The opinions expressed by our hosts and guests are their own and do not necessarily reflect the views of the Healthy CEO. Any information provided by our hosts or guests, including any physicians who may appear on the podcast, is solely for informational purposes and does not create any doctor-patient relationship. Listeners are advised to consult with their healthcare providers before making any changes to their health routines. The Healthy CEO and its affiliates assume no responsibility or liability for any consequence resulting directly or indirectly from any action or inaction you take based on the information provided in this podcast.